glioma is a tumor that arises from the brain tissue itself. It arises from what are called the glial cells, which are the supporting cells of the brain that provide structure and support and nutrients. And these tumors have the ability to span a whole range of degrees of malignancy from benign to very aggressive. The standard treatment for gliomas is radiation and chemotherapy. Typically, we operate on them to remove the tumor or biopsy it to get a diagnosis, and then treat it with radiation, which the standard dose is 60 gray, which works out to 1 treatment a day for 6 weeks, Monday through Friday. And then we use chemotherapy, an oral chemotherapy called Temodar, that is used to treat it. That is the standard treatment for gliomas. Now, there are many clinical trials available as well as immunotherapies for treating these tumors. Surgical treatment of brain tumors is when we either drill a hole in the skull to pass a biopsy needle in, or actually open the skull and go in and remove the tumor and put the skull back. Radiosurgery is done strictly with radiation beams. There's no cutting involved. Radiosurgery treatments are designed based on very accurately, stereotactically localizing the tumor, and then designing multiple beams of radiation aimed at the tumor so that each beam itself is not a high dose and does not damage the surrounding normal tissue, but where all the beams intersect at the target sees a very high dose so that the tumor itself sees a very high dose. So there's no cutting involved, and in many cases it is done as a single dose as an outpatient. Radiosurgery is very safe. It has a very long track record of at least 40 years. The goal of radiosurgery is to aim multiple beams at a target so that the surrounding normal tissue is not damaged. Only the target is damaged, and that would presumably be the tumor. There has been a lot of research and investigation into radiosurgery so that the present day technology is very accurate with localizing so that we can spare surrounding tissue, especially the very radiation sensitive parts of the brain, such as the brainstem and the optic nerves. In most cases, patients go home the same day with minimal to no side effects. The patients tolerate radiosurgery very well. From the patient's perspective, what's involved is they obtain a fine-cut brain MRI scan that is then downloaded into a workstation in the radiation oncology suite. From there, we set up the treatment plan and design the radiation approach very accurately using stereotactic technology. The patient is then brought in for what's called the simulation, in which they are fitted with a melted plastic mask which forms very tightly to the face. Then they lay down on the couch and the mask is applied, and the treatment plan that was designed is roughed out using light beams, not radiation beams, so that once we get the simulation set up and make sure everything is attainable, they're then brought back the next day, in which case they lay on the couch and the mask is applied very conformally to the face, and the treatment is delivered. Now, the beauty of the mask is that it can be reapplied as many times as necessary, so that in some cases where we cannot adequately treat the tumor with a single fraction or a single dose, they can receive multiple doses. I'm Dr. Kevin Judy. My mission at Jefferson is to improve lives.